Hello everyone. Are you ready to discuss the pediatric questions? Yeah, exam is over. So exam is over. Yeah, I have a feeling few question here and there. It's always there with the exam. But I wish, I hope, I pray that most of the questions you answer correct. Yes, pediatrics 12, 13 questions are there. 11 straight from our class. Yeah, one question always from here and there. So we try to discuss all those questions. Yes, myself, Dr. Sanjay Khatri, your pediatric educator at Medway. So here we go. FMG July 2024 Recall Pediatric MCQ. This question discussed in this PPT are the recall based and the motive live session to be get actual question asked in the exam, and we will discuss the probable plus and minus, so that will help you in further NEET-PG exam. Yes, I hope most of you will get good result. So this was the question. This was the question. Feeble lower limb and bounding upper limb pulse. See, this is coarctation. When coarctation is there, so this is the coarctation of aorta. So lower limb pulse not palpable, and simultaneously upper limb you have bounding pulses or hypertension. Upper limb will have hypertension. Lower limb pulse not palpable. One liner, my friend. This is the easiest question in the exam. So lower limb pulse feeble, bounding upper limb pulse. Yes, yes, yes. It is coarctation of aorta. Coarctation of aorta. These two, TOF and TGA, are cyanotic CHD. And PDA, we have all pulses bounding. But here only upper limb pulse is bound and lower limb is not palpable. Yes, it is coarctation of aorta. Neonate present with feeble lower limb pulse and bounding upper limb pulse. Diagnosis is coarctation of aorta. So many times asked. Now, this is the pure development question. Child can ride a tricycle. Child can ride a tricycle. Can go upstairs with alternate step, but not do the hopping. So we need to remember, it's a good question of milestone. Lot of milestone. Tricycle, child can ride by 3 years. Upstairs with alternate step, again 3 years. What do you mean? Child is lying here. Child is lying here. Now he go to next stair, one step, and the same step put on the next. Then this is upstairs by 2 step. Upstairs with alternate step comes at 3 years of age. Hopping. What is hopping? Jump on both legs. Hopping appear at 4 years of age. 4 years of age. Now child is able to do all the milestone of 3 years. All the milestone of 3 years, but not able to perform the milestone of 4 years. What is the age of the child? Yes, yes, yes. 3 to 5 years. 3 to 5 years. See it again. Tricycle, 3 years. Upstairs with alternate step, again 3 years. Hopping at 4 years. Child can able to do the milestone of 3 years. Ride a tricycle upstairs with alternate step, but not hopping. This means child is not 4 years of age, but child crossed the age of 3 years. So correct answer is 3.5 years. So many question is like this. Child can able to make a circle but not able to make a square. We have discussed so many times in the classes. Yes, yes, yes. I know most of you put it right. Ride a tricycle 3 year. Alternate upstairs 3 year, but not hopping. Hopping means jump on both legs. What is skipping? Jump on one leg. Skipping comes at 5 year. Another time, NEET-PG, this may be the question. Okay, so yeah, I know you are in a different mood this time, want to know what are the correct answer, learn, probably who will appear will also watch this class. So get an idea of FMG questions, and this will help you with the correct answer and your preparation for next level. Yeah, answer this question. All which of the following is the cause of unconjugated hyperbilirubinemia? So jaundice says unconjugated, conjugated. See, this is the liver. This is unconjugate bilirubin and it will convert into conjugate bilirubin. If unconjugate bilirubin increase in the blood, unconjugated hyperbilirubinemia. But once bilirubin get conjugated and spill into blood, normally conjugate bilirubin will excrete via bile into gut, then from stool and urine. It will excrete. But something which not conjugate bilirubin not able to excrete leads to conjugate hyperbilirubinemia. See, or which of the following is unconjugated? Our question is which of the following is unconjugated? Now, conjugate bilirubin forms but not able to excrete from the bile duct because there is biliary atresia. So what happened? Conjugate bilirubin spill into blood. So biliary atresia is the cause of conjugated hyperbilirubinemia. Dubin-Johnson and Rotor conjugate bilirubin form, but it's not able to excrete in bile duct. Not able to excrete in bile duct. Dubin-Johnson and Rotor again causes of conjugate hyperbilirubinemia. So Gilbert syndrome, there is an enzyme uridyl transferase. What happened in Gilbert syndrome? There is deficiency of this enzyme. So unconjugate will not able to convert into conjugate. Unconjugate will not able to convert into conjugate. So Gilbert syndrome, unconjugated hyperbilirubinemia. And one more MCQ on Gilbert. Anybody? One more MCQ on Gilbert. In which of the following syndrome jaundice increase with fasting? It is Gilbert syndrome. It is Gilbert syndrome. Jaundice increase with fasting. It is Gilbert syndrome. Am I clear? Am I clear? So which of the following causes unconjugated hyperbilirubinemia? It is Gilbert syndrome. Rotor, Dubin-Johnson and biliary atresia are the causes of conjugated hyperbilirubinemia. Are the causes of conjugated hyperbilirubinemia. Yeah, this was the question. I am not able to get the whole. Probable this was the question. A child with caffeolate spot. It will not help because there are 10, 12 conditions in which caffeolate spots are there. One more finding should be there. Leash nodules. Anybody, if any change in the language, you can type in the comment box. Caffeolate spot and leash nodule in iris is diagnostic of. If caffeolate spot with leash nodule, that is neurofibromatosis type 1. So what is neurofibromatosis? It is a autosomal dominant condition. There are 7 features. Caffeolate spots on the body, hallmark of neurofibromatosis. You can't make the diagnosis in your neurofibromatosis without caffeolate spot. Axillary or inguinal flickering. Leash nodule in iris, prevalence increase with age. Plexiform neuroma, optic glioma, most common tumor in neurofibromatosis type 1. Osseous lesion in the form of scoliosis, pseudoarthrosis, sphenoid dysplasia, and family history present. To make the diagnosis of neurofibromatosis, you need two features. One is always capsulate spot, present in 100%. In our question, second feature is leash nodule. I may be little bit change in this question language. You can help me. What was the, because 2-3 people WhatsApp me or send on my telegram that this was the question. This was the question. Child with capsulate spot, leash nodule in the iris. Diagnosis is neurofibromatosis. Yes, tuberous sclerosis, some other feature, Sturge-Weber syndrome, one of the most important question for FMG exam. Facial labius on one side, glaucoma on one side, paralysis convulsion on other side, Sturge-Weber syndrome. We have 2-3 times previous year question. This time they pick neurofibromatosis. Yes, sometimes, but you are intelligent people, you know most of the things in our notes. So yeah, neurofibromatosis type 1, capsulate spot, leash nodule in iris. Again, can you believe this statement? Last 5 exam, 4 time questions is from pyloric stenosis. And we discussed so many time in the class, so many details. This is the simplest question on pyloric stenosis. Now see, this is stomach and here is the stenosis, pyloric stenosis. Stomach, HCl excrete. When vomiting is there, this HCl is out, H ion and Cl out. What it leads to? It leads to hypochloremia. H ion out, it leads to metabolic alkalosis. So no confusion, no confusion. Yes, most common characteristic of pyloric stenosis, hypochloremia. You are lucky they ask easiest question. Sometimes they ask hypochloremic metabolic acidosis, hypochloremic metabolic alkalosis, hyperchloremic, then you get confused. So they ask simple, which is the commonest. Hypochloremia is the commonest. If commonest biochemical abnormality as a whole they want to ask, then hypochloremic metabolic alkalosis. Hypochloremic metabolic alkalosis, because acid is lost from the body. So what they found in pyloric stenosis? Hypochloremic metabolic alkalosis. Hypochloremic metabolic alkalosis. Mother taking erythromycin during pregnancy, baby will have pyloric stenosis. Vomiting is projectile, non-bilious. Lump, peristaltic wave, move from left to right. Lump, palpate in epigastrium. String sign on barium. Investigation of choice, USG abdomen. So these all are the MCQs of previous year, previous 4 times they ask question on pyloric stenosis, and we discuss everything in our top 100 questions of pediatrics few weeks back. Okay. Hope you make it right. 7-year-old girl with frequent episode of staring, blank look, unresponsiveness. Frequent look of staring, blank look. Sudden cessation of motor activity with blank look. This is absence seizure. And drug of choice for absence seizure is ethosuximide. As per Nelson, ethosuximide. Yes, we can give sodium valproate also. Sodium valproate with our choice. The best is ethosuximide, and this is absence seizure. You're supposed to know few point about absence seizure. Sudden cessation of motor activity with blank facial look. more common in girls, rarely below 5 years, multiple episode in a single day, rarely last for more than 30 seconds, no aura, no aura, no aura, EEG show 3 spike per second, 3 spike per second, and hyperventilation precede the attack. You may find so many questions. Which seizure EEG show 3 spike per second? Absence seizure. Hyperventilation preceded by which seizure? Which seizure precede hyperventilation? It is absence seizure. Absence seizure. Yes. Drug of choice is ethosuxamide and sodium valproate. I inquire so many students. Sodium valproate is not in the choice. Then we left with ethosuxamide. Ethosuxamide. Am I clear? Any change? You are the person. Guide me. I was not there in exam. I am there to helping you. If some other choices are there, if any other language are there, if little bit more points in the clinical history or some change in the alternates, let me know in the comment box. Let me know in the comment box. So this is absence seizure. As per this, drug of choice is ethosuxamide. Relative bradycardia seen in. Is this the question, or they asking in all except? Still I am not able to find out. Leptospirosis, yes. Brucellosis, yes. Dengue typhoid, yes. Bordetella, no. What is relative bradycardia? When there is increase in the temperature, 1 degree centigrade, heartbeat increase 10 beats per minute. So temperature is increased, heart rate also increase. Temperature increase, heart rate also increase. But there are few fever, typhoid, brucellosis, leptospirosis when only temperature increase, not the heart rate. So what word we use for that? Relative bradycardia. So I need your help. Is question they are asking which of the following relative bradycardia or all except, because relative bradycardia is in leptospirosis, brucellosis, yellow fever, dengue fever, but not in the Bordetella. Okay, yellow fever is also a cause of relative bradycardia. Other causes, yellow fever, drug fever, temperature increase, not the heart rate. Relative bradycardia. Relative bradycardia. It's a good clinical question. Yeah, this question I get first. So many students were telling this was the question. Simple. So what you are seeing? 1 bubble, 2 bubble, 3 bubble. 3 bubble sign. It is duodenal atresia. If you find 2 bubble sign, sorry, jejunal atresia. If you find 2 bubble sign, it is duodenal atresia. 1 bubble seen in pyloric stenosis. Yes, 3 bubble sign, jejunal atresia. Intestinal obstruction, you find multiple fluid levels. Multiple fluid levels. Yes, 3 bubbles are there, jejunal atresia. Duodenal atresia, they asked 2 years back. Commonest antenatal diagnosis of Down syndrome, duodenal atresia. Jejunal atresia, when clearly 3 bubbles are visible. Yes, sometimes this type of question, my very good student put answer duodenal atresia because he was confused whether third bubble is clearly seen or not. Yes, it's 3 bubbles are clearly seen. So it is jejunal atresia. Jejunal atresia, image based question in pediatrics. Few more are there. These are typical. Now see, these all are typical, and I hope you will able to do all. Simplest question. Upper limb hypertension, lower limb feeble. Lower limb feeble. Feeble lower limb, upper limb bounding. Coarctation of aorta, my friend, no other possibility is there. Simple question on milestone. We have discussed so many questions on milestone. Tricycle 3, alternate step 3, hopping 4. So age of the child between 3 to 4. Unconjugated conjugated hyperbilirubinemia. Very clear. Gilbert is a cause of unconjugated hyperbilirubinemia. Point to learn today. Which syndrome? Jaundice increase with fasting. It is Gilbert syndrome. It is Gilbert syndrome. Capulate spot. No clue. But leash nodule make the diagnosis of neurofibromatosis, because we need one more point other than capulate spot to make the diagnosis of neurofibromatosis. Pyloric stenosis. This is probably the easiest question you get in your exam. Probably from pyloric stenosis, because we know everything about pyloric stenosis, because this is the one of the most important topic in as per previous year FMG papers. We are prepared for this question. Simplest, hypochloremia is the most common electrolytes imbalance, because chlorine out in the vomiting. Absence seizure, ethosuxamide. On absence seizure, frequently questions come. EEG shows 3 spike per second. Hyperventilation associated with which seizure? This is absence seizure. Relative bradycardia. I am not sure what was the question. They want to ask choose one, or all are relative bradycardia except, but I give you the concept. This is relative bradycardia when temperature increase but not the heart rate. These are the example. Triple bubble sign, jejunal atresia. Yes, go with your memory. Few more questions you can put into pediatrics. Vitamin A deficiency, Bitot spots. Drug of choice for infantile spasm. Drug of choice for infantile spasm. You need to see whether it is idiopathic. Sorry. You need to see whether it is idiopathic or it's a part of tuberous sclerosis. If it's idiopathic, drug of choice is ACTH. Tuberous sclerosis, vigabatrin. This was the question everywhere. But yeah, it's a typical biochemistry question. They ask self-mutilation, which is a feature, which enzyme deficiency is there. Self-mutilation, self-destructive behavior. We have discussed so many times in our classes. Child start eating the nail, then lips, then finger. Terminal stage, whole finger will be amputated. Self-mutation, self-destructive behavior is a feature of Lesch-Nyhan syndrome. It is due to deficiency of HGPRT. One question was there on trisomy 18, Edward syndrome. Okay, overlapping of finger, and one person told me that they are giving the karyotype. This is 17 and this is 18. On 18 there are 3 chromosomes, but still I am not sure what was the question. But one question on Edward. So if they give the karyotype at 18, you find 3 chromosomes. But if they want to ask question about Edward, overlapping of finger, hypertonia, prominent occipit are the classical feature of Edward syndrome. Overlapping of finger, hypertonia, prominent occipit is the classical question on Edward syndrome. We discussed Edward, Patau, Down, Turner, Klinefelter, Fragile X very well in our class. Is there, sir, Mukesh, you want to ask? There was multiple leash nodule. So multiple leash nodule in iris. Again, its favor. Capulate spot with leash nodule. Mukesh, its favor neurofibromatosis. Its favor neurofibromatosis. And one more thing, incidence of leash nodule increase with the age. You not find leash nodule in a 3-year-old child. Neurofibromatosis by 30 years, you find almost every patient will have leash nodules. So prevalence, number of leash nodule increase with the age in neurofibromatosis. So these are the pediatrics question, 12, 13 questions. So I hope most of them are very simple. Upper limb hypertension, lower limb not palpable. Question on milestone, question on pyloric stenosis, drug of choice for infantile spasm, question on absence seizure. It's very good one. Probably hope you make it right. Okay. So What's now? Hoping for best result. This is the time. I know you work very hard. This time you are in state pata nahi hoga, nahi hoga, jo bhi hoga. We have done our maximum. We have done our maximum. Now relax with your family. Yes, your family needs you now. And you will be more relaxed, more calm if you are with family in coming week. Be there. Forget about result. Today only discuss all the questions from all faculty about that. Make your expected marks. These are the question we are right. This is the maximum which you can do. Rest up to the God. God have some plan for you, my man. Nothing to worry. Nothing to worry. Yes, relax with your family. Myself, Dr. Sanjay Khatri, your pediatric educator on Medway. Keep reading, keep learning. Ongoing process. Thank you very much. Hope to see you all. Pass with flying color and join us again for NEET-PG preparation.